This video is designed to be used as a guide on how to perform the InLow's 60-second diabetic foot screen. Based on the results from the screening, clinicians are able to determine the level of risk to a person for developing ulceration and amputation. The screening is broken down into 4 sections. Skin and nail changes, assess for peripheral neuropathy or loss of protective sensation, assess for peripheral arterial disease, and assess for bony deformity and footwear. 1. Skin and nail changes. Begin the assessment by looking at the general appearance of both feet and checking all skin surfaces, including the backs of the heels and between the toes. Things to be keeping an eye out for are any areas of excessive callus, deep fissuring or cracks in the skin, excessive moisture between the toes, blisters, previous or existing ulceration, and signs of fungal infection, such as areas with a red, scaly rash. After examining the skin condition, check the condition of all of the nails, looking for any signs of excessively thick, damaged, ingrown, or infected nails. Check to see how the nails have been cared for. They should be cut or filed straight across without any jagged edges or spikes. 2. Assess for peripheral neuropathy or loss of protective sensation. This test will be performed using a 10-gram monofilament. Demonstrate on the back of the person's hand or arm what the monofilament will feel like so that they are aware of what to expect on the foot. Have them close their eyes and ask them to say yes every time they feel the sensation of the monofilament on their foot. Holding the monofilament perpendicular to each side, apply pressure until the monofilament bends into a C shape. Avoid testing areas where there is callus, scar tissue, necrotic tissue, or ulceration. The 10 sites to test are plantar ends of the toes 1, 3, and 5, plantar metatarsal heads 1, 3, and 5, plantar medial and lateral border of the foot, the plantar heel, and the top of the foot. If the monofilament is not detected in an area of the foot, this indicates a loss of protective sensation to that area. After performing monofilament testing, ask the person the following 4 questions and record any yes answers. 1. Are your feet ever numb? 2. Do your feet ever tingle? 3. Do your feet ever burn? And 4. Do they ever feel like insects are crawling on them? 3. Assess for peripheral arterial disease. Begin by checking arterial flow in the dorsalis pedis and posterior tibial arteries. The dorsalis pedis is usually located between the extensor tendons of the big and small toes and just in front of the navicular bone. The posterior tibial artery is located just behind and below the medial malleolus. Ankle edema may sometimes make this difficult to find. After recording the presence or absence of pedal pulses, look at the general appearance of the foot and lower limb. Look for any signs of dependent rubor, which is a dusky red appearance of the foot and lower leg when the foot is hanging in a dependent position. Other signs of poor circulation in the feet may include hair loss, thickened nails, and poor skin health. Finally, using the backs of your hands, assess for any coolness in the feet. Monitor for any significant differences between the left and the right feet. If weather conditions are cold outside, allow time for the person to warm up before performing a vascular assessment. 4. Assess for bony deformity and footwear. Examine the foot for any deformity that may lead to any areas of increased pressure. Things such as bunions, rigid claw toes, dropped metatarsal heads, or any bony changes due to Charcot foot. Note also for any areas of previous amputation or the presence of active or acute Charcot foot. This will often present as increased warmth, redness, and possibly swollen. Look at the quality of movement at the hallux by moving it up and down and feel for the kind of movement available. Note whether it is freely moving and flexible, has some restrictions of movement, or is very stiff with no movement. Finally, check the footwear to see whether it is appropriate for the person's feet. Start by looking for any signs on the foot of trauma that may have been caused by the shoe. This may include things like areas of rubbing, blisters, corns on or in between the toes, or pressures from foreign objects inside the shoes. Inspect the shoe and inner sole to see how much cushioning and support they will provide. Check to see that the foot will be fully protected and covered. Finally, note how much wear and tear there is on the sole of the shoe, inside the shoe, and on the upper material. With the shoes being worn, assess the fit of the shoe on the foot with the person standing. Things to check will include: is the shoe long enough for the foot? Is the shoe wide enough across the forefoot? And is the shoe deep enough for the toes? A shoe that fits properly should not have any excessive pressure on the skin or cause irritation when being worn. The toes should not be sitting against the front edge of the shoe or the upper material of the toe box. Using the findings from your assessment, you will then be able to determine the level of risk for ulceration and amputation. Based on this classification, you will be better able to develop care pathways that will meet the needs of each individual.